Hello, everyone, and welcome to the Wise Decision Maker Show, where we help you make the wisest and most profitable decisions. Today, we'll have one of our Decision Maker Revealed episodes, and I'll turn it over to the decision maker himself to share more about what he does and the kind of decisions that he makes. Please go ahead, Chet.
Thank you very much, Gleb. Appreciate the opportunity. My name is Chet Czaplicka. I'm the CEO and President of Comprehensive Care Services. We are the largest blood handling perfusion corporation in the United States. We have been in business since 2002 and currently in 22 states, spread across 217 hospitals, 650 clinicians spread out amongst those institutions.
Excellent. Thank you very much, Chet. Now, tell listeners, and I know you and I have talked about this a number of times privately, but tell our listeners what kind of challenges you've experienced during this difficult time of the COVID pandemic.
Sure. One can only imagine, because we're in medicine, preferentially in cardiac surgery, but we also do a whole lot of other surgeries because we do blood salvaging on orthopedic, neuro, and trauma cases. When the declaration of COVID pandemic was first announced by the CDC, we started to see hospitals filling up across the country. And again, as I stated, we're in 22 states. Mm-hmm. So we saw varying, varying caseloads at these institutions. Some places harder hit than others. The larger concentrated metropolitan areas were much harder hit, mm-hmm. mostly due to the concentration of the population. And I think people continue to do what they thought was normal, even though there was reference to should be wearing masks, we have to be more careful. That's sort of hard to do when people didn't understand the brevity of the pandemic itself. And what we saw early on is a pretty significant drop in our caseload. Mm-hmm. Certainly on the elective surgical side, there was about a 74% reduction in caseload. Mm. And to get your heads wrapped around that, that would mean people getting knee replacements, hip replacements, back surgery, other neuro operations going on. Trauma cases didn't change that much early on, but drastically changed afterwards because the amount of traffic on the roads drastically reduced the amount of trauma that was out there, which is a good thing. The bad thing that happened, though, from this was we saw a cardiac caseload drop approximately 71%. About 55% of our cases are urgent emergent cases. Mm-hmm. And what that means is the patient comes to the institution, a hospital, goes usually to the cath lab, gets a diagnosis, and then within a day or two is coming to us for a surgical repair of some sort. So those cases weren't being seen in the ER. A lot of those patients were being driven away from the ER because they were frightened. Physicians were recommending patients not come in through the ER. The ERs were completely overwhelmed with COVID cases. What happened is a lot of those patients unfortunately died. This is one of the factual items that people don't hear much about, but the reality is that, you know, we made a whole bunch of decisions early on. And when I say we, I mean the CDC, mm-hmm. other people in the federal government, hospitals doing what they thought, you know, was the best. Mm-hmm. And unfortunately, only made it much worse, to be completely honest. When we saw those drastic drops in caseload, of course, we have clinicians that are full-time in the corporation. We immediately started to what I call twist down the screws in the financial world in our side anyways. So anything that had to do with hardware purchases that we could put off, we put those off. Mm-hmm. Any other capital expenses, we put those off. Any new hires, we froze positions temporarily. But one thing we did not do is we did not lay anybody off. Shortage of personnel in the medical field. We knew this early on. We let people go. because we didn't have caseload, we'd probably lose them and not get them back.
Yeah.
So by tightening all of our financial screws, we certainly dipped into our what I'll call our rainy day funds. So for about 6 to 9 weeks, we saw a pretty large financial hit to the tune of about 27 to 28%. And technically, those months we were upside down. So we were in negative territory in terms of income. But because we were fortunate enough to have not only bank available funds related to lines of credit, which we never did dip into, but the bigger thing, I think, maybe because of my Depression era parents, we are very attuned to making sure that we had at least 3 months of cash in our bank accounts. So we bled out about 6 to 7 weeks of that money before it started to turn around. And it turned around relatively quickly. One, I think because the summer months came, I think the virus started to wane a little bit in the summer months. You could look at this, from a standpoint of looking at the CDC information, you could see what was going on in the country. The cases started to come back. Things started to open up a little bit. But as we all know, the fall hit, and we found ourselves sort of back into the gloom a little bit.
Yeah, I had a question before we move on to the fall. Now, you said that the CDC shut things down. You said that there were some problems. Now, imagine if you were, the COVID SAR or in charge of the situation. What would you have in terms of decision making? What kind of decisions should the CDC have done differently from your perspective?
Yeah, it's
in
so
the
hard
early
to say.
onward.
They're in a very difficult position, not understanding the nature of the disease. Unfortunately, the Chinese knew a lot about it. They weren't forthcoming. The WHO wasn't able to get the information from them either. And this is what happens when you're in a closed society, unfortunately. So we were, I would say, flying by the seat of our pants. And they were flying by the seat of their pants. In that decision-making process, some things they did know. Some states made some very bad decisions. They unfortunately sent COVID-infected elderly patients back into nursing homes, only making those situations much worse. You can list those states out. It's pretty well known, but that was an awful error that, again, was made by about 5 governors in the country. They unfortunately were either given bad information, which those governors weren't medical people, or they thought they were doing what I'm assuming was the correct thing to do. Because I don't think anybody intentionally would have sent sick patients into a situation knowing that they were going to make more patients sick, expose the disease. And this disease, somewhat like the flu, affected the elderly. Obviously, they took the hardest hit. It affected those people who had multiple comorbidities. Obesity was one of the big factors that was involved that we started to see in our ICU patients. And even the physician community made a bunch of decisions based on what they thought was the right thing to do, putting patients on ventilators, as an example. Now we do everything we can to don't put a patient on a ventilator. But with that being said, we did learn pretty quickly. And one thing that the government did do correctly, if I can say, is they deregulated or removed some of the regulatory burden on getting these vaccines out. Because if you think about it, how quickly those vaccines came to market.
Oh, definitely.
It's amazing. And, we have, what, 250 or 260,000 million, 250 to 260 million vaccinations given in the United States with a very, very low incidence.
Yeah.
What I'm going to say, comorbid, conditions occurring after that.
Mhm.
So that in and of itself shows what the government is capable of. I think that we certainly have all learned a lot from this pandemic. One of them is, I think the most important one is never assume. We have to be careful to not assume.
Mhm.
Trying to keep the general population isolated, another really bad idea. Because if you look at the psychology and what's happened to a lot of folks out there in terms of depression and the suicide rate, they're incredibly high right now still. And human beings aren't meant to be isolated. We're herd animals, Gleb. You know that. We like to be around other people for the most part.
So you would, if you were the COVID SAR, you would have recommended not isolating people, not kind of having those lockdowns. Is that what I'm hearing?
The difference between a lockdown and those states that didn't lock down, there wasn't much of a difference. There really wasn't. The Delta variant, I think, is maybe showing us something a little bit different, but even that's hard to tell at this point as well. If we look at Texas and Florida, which have been hit pretty hard by the Delta variant. So I think lockdowns could have been isolated. The suggestions of isolation could have been directed more tightly to those folks that are most susceptible. Shutting the schools down was probably one of the worst things you could have done, because if you look at, again, the teenage suicide and depression rate is very high as well. But again, I'm not here to judge those people, because
I asked you the question because you're obviously a medical expert, so I'm looking from your perspective. Now let's get back to CCS perfusion. So in the fall there was a better situation, definitely, and I know from talking to you that you are also involved in some acquisitions at that stage. Can you tell our listeners about how you made those decisions? And I mean, that obviously bears some risks with acquisitions during the pandemic. So you had to have some risk-benefit trade-offs in your decision-making there. Tell us a little more about that.
I think, Gleb, the big thing is there's a lot of small corporations in our field, okay? And what I mean by small, $2 to $5 million in revenue. A lot of those folks didn't necessarily have bank lines of credit to fall back on. They maybe didn't save enough money. And I think a lot of those folks got very frightened by what was going on. And then when COVID kind of did that uptick again, I think that a number of those people said, I don't know if I want to go through this again. We also had a fair amount of early retirements in our profession. The Wall Street Journal, as an example, said between 2.4 and 2.6 million additional early retirements occurred during COVID.
Wow.
That also affected us. So you had these small corporations losing people. We're in a shortage of personnel. What do? They do what a lot of other people would do. Said, you know what, I have to protect the asset that I still have. And they decided to test the waters. We were very fortunate, again, as I said earlier, our bank lines of credit were really good. And careful not to maybe mention my bank name, but they have been exceptional through this whole process with us. And maybe I should put her out there for them.
Yeah, sure. You can put out a testimonial. I'm sure they'll be glad.
The PNC is our bank, and every step of the way they said, how can we help? What do you need from us? They actually came and said, we're going to increase your bank lines of credit. We see what you guys are doing. We really like it. You guys are surviving nicely through this process. Your margins got pinched early on. you're back to normal, working through this process very well. So, we were the least risk they could take, if you know what I mean.
Wonderful.
On the other side of the coin was hospitality, which was crushed, absolutely crushed, So, from that standpoint, the ability to go out and do acquisitions, which we did, was wide open. It really was. And the unfortunate thing was we could have done a lot more if we had enough people. But professionally, there's a shortage in our field as well. So to go and try to grab more business, not have the clinical professionals to provide the service, couldn't do it. We couldn't do it. So we actually restrained ourselves from doing too much. I think the other thing is we were back and forth with having part of our office staff working from home, back in the office, flexing time, et cetera. I think it was in the fall, we brought everybody back to be in the office, knowing full well that we needed to be here from a collaboration standpoint, especially with doing the acquisitions. You could only imagine trying to do acquisitions with your staff spread out in various locations. Our head of technology is sitting in the room with me, and we had him scurrying around like ant on an anthill, trying to get all the parts and pieces put in. And then you dump on top of this. Think about this, Gleb. You dump on top of it a shortage of computing hardware.
Okay, yeah, with all the shortages.
We have to deal with that because we start up these new hospitals. We have to have computers. We have to have laptops. Some places needed handhelds. So our technology director is like, hey, guys, I'm warning you, there's a pretty severe shortage out there. And it's probably going to get worse. So he also came to us and said, hey, strategically, we need to beef up our inventory. Which we've done, and find other resources to supply the computing that we need. So we even had to think about that. We bought extra heart-lung machines as an example at $165,000 to $185,000 each. Not a fun thing to be sitting on from an inventory standpoint. But again, we were prepared, and that led to what happened in 2021, where we're having our largest growth that we've ever had, because we have what we need for the most part. We're still tight on personnel, but again, we didn't lay anybody off. We kept everybody on board.
That's great.
The freezing of staff wasn't out in the field. The freezing of staff was here in the office. The non-clinical people who support our clinical folks. So
and that must have been hard, the freezing of staff when you were doing acquisitions.
Very difficult. I mean, you almost have no idea. We have over 650 employees in the corporation. So to kind of give you the idea of the brevity of the situation we were in, and the payroll and the benefits. But even don't forget, the federal government worked closely with all the businesses out there. They allowed us to not pay our FICA match, as an example. Our FICA match, runs in the neighborhood of about $500,000 to $600,000 a month. So we were able to save those dollars. Of course, we had to pay it back, but because of allowing us to have it delayed, we're allowed to, again, build up our bank reserves. So those are all things. The government did some really, really good things from that standpoint. I think the, trying to get, the money out to the small businesses, that was a bit of a tangled mess, I would say. But when you had every business in the country trying to submit applications through the SBA, you can only imagine what that did to their computing system. Because I don't think the government was prepared for the barrage that was going to come in.
No, I was reading that it was not prepared for some of the larger small businesses to submit applications. It thought it would only smaller businesses would submit. So I wanted to go back to the theme that I've been hearing running throughout your conversation about being prepared. It kind of reminds me of the Ben Franklin quote, "An ounce of prevention is worth a pound of cure." And that's what I do, and what you and I talked about future-proofing, protecting your future. What led you to have this kind of mindset to be really prepared and having sort of a defensive stance where you have sufficient lines of credit, all of that stuff, not biting off more than you could chew, which is definitely a problem frequently for many folks. What caused you to have this more thoughtful and mindset? Tell me a little bit more about that.
Well, I would say first and foremost, I'm a fiscal conservative. So I run my life how I run my business. So we're always very careful about not stripping every dollar out of the corporation. So along the way, we've always had that mentality. So going into what I would say a situation like this, nobody expected it to be a pandemic. It could have been our building got destroyed in a tornado. You know, there was a lot of things that we've always done along the way. And as an example, we've done a fair amount of what I would say crisis management. So, you know, with our technology folks, are we prepared? You know, do we have backup plans? Is our financial information backed up someplace? Not just on a computer disk in our office. Do we have cloud backup? Do we have all those things? It was sort of pervasive through the entire organization.
So it's a culture. It's a cultural thing.
It's a culture for us. And anything I can say to people starting a business, people in business, is I think you got to realize that you need to have that culture built in. Right? And if you don't, you could be in a situation where, you know, you force yourself into a bankruptcy situation. Because it could happen pretty quickly. Think about revenues dropping off that much, and you have all these folks on your payroll. Can you make that change rapidly enough? Do you want to get rid of these people? Do you want to keep these people? If you get rid of these people, you're going to lose all this experience. Can you afford to do that? And the answer is no, I don't think you can. And so, you know, we were fortunate enough to be in that situation. I wish I could tell you there was some magic bullet. There really wasn't. I mean,
it's not a magic bullet. It's a mindset of being prepared and a culture of being prepared and having that risk management. I mean, I think that's relatively rare for people who are in startups. I mean, you've been running a startup and you have yourself from that 2002 when you founded it to this stage, you've become a really great leader in terms of knowing how to run a maturing startup, so to speak. It used to be a startup, now it's kind of a maturing company, and you are really prepared for these serious threats, whether it's a pandemic, like building burning down, all of these sorts of things. And did you have that mindset from the beginning when you were starting the company?
Yes. And then one thing I will say too is that communication. You have to communicate with all the people in your corporation. So we had frequent meetings with HR, finance, technology side, you know, which is running everything, making sure that we were prepared. Them telling us, you know, this is what our recommendations are. You know, this is what we need to be looking at. This is what we need to be thinking about. And all those things are very strategic. But the communication piece, remember, human beings are fearful of what typically they don't know.
Yeah, certainly.
You don't want people to presume. You want them to understand. And even through the bad news, people were appreciative of getting the news without the BS. Right? You know, it wasn't like watching the news networks, whether it's ABC, NBC, Fox, MSNBC. You know, it was all the hype and the bull. It was more coming down to, hey, listen, this is really what's going on. Right? This is really what's happening to us. And I think that helped our folks to coalesce,
Mhm.
together, that we're going to get through this.
Mhm.
And here we are today,
Yeah,
flourishing.
that's wonderful.
COVID's still around,
Mhm.
the pandemic's still quote unquote out there. But we've learned so much through this process. Not only we as a business, but we as a society.
Yes.
Continue to learn. So.
And so let's go back to you as a business. You've clearly made some decisions that were informed by your culture before the pandemic, and the risk avoidance, transparency, communication, preserving resources, taking advantage of situations like the acquisitions without biting off too much. What did you learn? How is the company and you personally, how are you different in your decision-making now that we are in the stage, hopefully, of coming out of the pandemic and making it more of an endemic?
Well, I think like in any crisis, any disaster, those are probably the best opportunities to learn. One, we affirmed what we have been doing was the right thing to do, because we certainly had our investment advisors and the corporation saying, "I don't know why you guys have so much money in the bank." As an example. Well, they came back and said, "Wow, we were really wrong." Yeah. Again, fiscally conservative. I think additionally, what we learned was in times of high stress, you need to keep your folks informed, and it needs to be a two-way communication. We tried to be very sensitive to people who were afraid to come into the office, as an example. So we gave those people a little more leeway, but we also said, "Hey, listen, we're going to give you this leeway. We're going to show you that it's safe in the office." And other things we did in the office are cleaning people who physically clean our office. Early on, we bought one of those nebulizers, all right, like the airplanes are using now. And we had the cleaning crew trained to use it to provide that nebulization in the office on Monday, Wednesday, Friday. So we sort of tried to keep everybody very comfortable. We recommended that people eat their lunch in their offices. So we learned a bunch of things along the way in terms of keeping people comfortable.
That's an important lesson.
Was it scientific? I don't know. It was using the science that we had, but more about using human psychology. If you know what I mean. If you can use that psychology to make people comfortable in their situation, in their environment, I think you're a step ahead of the game, right? Really getting people to say, "Hey, listen, these people are concerned about me," in which we were, but going to above, what other companies were doing and getting these machines in here to make sure. We even thought about installing the black lights in all of our venting because the virus didn't do well around that lighting spectrum, so it actually kills it off. So there was a lot of things that we did along those lines as well to make sure that, again, the office environment felt like a very safe place to be.
So it sounds like there's that risk avoidance, there's that transparency and communication, but also an additional lesson, an important one, is the importance of making people feel safe and comfortable, not simply retaining them on the payroll, but helping them feel safe and comfortable and addressing those psychological needs, regardless of how much whether the science fully agreed with the standards that you were implementing.
Right. The other thing we did, we went out and bought the N95 masks very early on, and we secured those for our staff out in the field because there was a pretty big shortage of masks, as you well know. Some people wanted to get the face shields, so we were able to get the face shields for those people as well, because we were in a situation where we were being exposed to COVID, nearly every day.
Sure.
I would say right now we probably have 98% of our folks are fully vaccinated.
Mhm.
The 2% that aren't are some people here in the office that have elected, not to do it.
Mhm.
While I think that's a bad idea, again, I'm not here to force anybody into a situation. But, we also did some things along the line of if you decide not to take the vaccine and you get sick, it's non-paid time off.
Mhm. That makes sense.
It's a disincentive to not go get it. And I think there was a lot of fear mongering that had gone on with the vaccine. I mean, unfortunately, social media
Yeah.
isn't the best place to get your news.
No, no, it's not.
Some people think it is, but
No.
I would say it's a really bad place to get your
Yeah.
right?
Social media is well known for spreading lies much more quickly than truth.
Yeah, unfortunately, and it unfortunately affected a lot of people.
Yeah.
Because even now, if we look at the people who are unvaccinated in the country, it's the people who really need to be vaccinated. It's a lot of minority populations, et cetera. So, and we need to really educate people. That's really what it is. Correctly.
Yes.
And with science.
Absolutely.
Instead of social media. So.
Now, I want to turn back to COVID and your personal experience. I know that's something you unfortunately were ill with COVID. Did that change your perspective on the disease and on the whole experience? I'm curious.
Not really, because I was one of those people, one of the 85 or 88%ers that had relatively minor symptoms. I had a headache for a couple of days. I lost my sense of taste and smell,
which is not a light thing to do.
No, it was pretty rough. But the general muscle aches, it felt like the flu. And after about day 3, I started to come out of it pretty quickly. There were some things I did that, personal things and taking vitamins, et cetera. Do I think it helped? I don't really know. It's so hard to tell. The worst part of it was cooking meals and asking my girlfriend to taste it, because I had no idea what it tasted like.
Sure. Ouch.
I didn't know if it needed salt. I didn't know if it needed pepper, anything.
That's rough.
Seriously, couldn't smell anything, which is very strange. I actually lost weight because I had no appetite.
I bet. I mean, if you can't smell or taste it, it's not fun to eat.
Not at all. But I will say that, people shouldn't take my experience and use it as a reason not to go get vaccinated either, if somebody is watching this, because frankly, there was a whole bunch of people that we saw in the hospital that were very sick, and a whole bunch of people that died.
I mean, it even happens with people who are vaccinated. It's so strong. Colin Powell just died and he was vaccinated. So there's some breakthrough cases. I mean, if that's that strong, of course, the vast majority of the people who die right now aren't vaccinated, but it's a very, very powerful disease not for everyone, but for many people.
Right. Yeah. The interesting thing is everybody assumed that the flu disappeared. Well, what it was is that a lot of those flu cases, I'm going to assume, were actually probably diagnosed as COVID cases through this whole process. The flu is out there. If I can also say to anybody, go get your flu shot.
Oh, yeah.
Go get your flu shot. It's a really good idea. The flu didn't disappear because COVID's here. It's just, let's say, was put over the fence a little bit. Okay.
Well, I think masking and social distancing also helped reduce it.
It probably did, but maybe that's where the mask came in. Maybe it reduced it a little bit there as well. But I would say, getting your vaccinations, getting your checkups, making sure if anybody's got cancer, going to your cancer treatments in a timely fashion, continuing to get your screenings done when they need to be done. All these things, I mean, so many people put those things off because they're afraid to go in the hospital, afraid to go into the clinic, afraid to see their doctor. I mean, that's something that we've learned first and foremost. Do not put those things off.
I absolutely agree with you. I had a colonoscopy scheduled in the fall of 2020, and despite the problems and the many patients, I went and got my colonoscopy.
Well, you're lucky you were able to do that.
That is not so fun. Yeah.
But, I mean, that's again, it's a cancer screening mechanism.
Yeah, no, I mean, so it's really important. Now, as a last question, what do you think CCS perfusion, how do you think it will go forward, and how do you think it will be different after the experience of the pandemic?
I think the biggest thing is that we have become even more strategic in our thought process in looking at, as an example, you would think you can go buy a computer anytime. Well, guess what? We realized in a chip shortage, you can't even buy a car, right?
Yeah.
So I think we're going to naturally allow those inventories of computers and things that we need from a hardware standpoint to make our business work. I think we'll keep a little higher inventory of those things. We're keeping some emergency stock of critical items that we use in the operating room, such as heart-lung packs and oxygenators. An oxygenator really it's an artificial lung that we use during a heart operation. We're keeping some extra long-term membrane oxygenation devices here in our building as well, because we had a lot of hospitals calling us and say, hey, we don't have any inventory, can you help us out? In circumstances, we were able to help them out.
Excellent.
So from that standpoint, on that side of our financial sheet, our balance sheet, it looks, right now, probably a little heavier than what I'm going to say in assets, capital assets. But I think not knowing what could be next is, it isn't ridiculous. I didn't go overboard with it, but I'm keeping a little higher inventory in those items right now. I think the other thing, that I would say we learned is that communication, first and foremost, is probably the most important thing during any disaster. And keeping your employed folks knowledgeable of what's going on in the corporation, letting them know that you're doing everything you can to make sure that the company is viable and staying viable is important. And those messages don't maybe sound crazy important right now when we're talking about this in a relaxed atmosphere, but in the middle of what I would say a disaster, it'll mean a lot to people. It really will.
That's very understandable. Calming people's anxieties, addressing their emotions, very important. Well, is there anything else, anything final that you would like to tell to our listeners?
No, all I can say to everybody out there that, I would say if you have a company, whether you're a startup or you're advancing in age like we are, think about the fiscal conservative item that I have brought up multiple times. Think about making sure that you have your bank lines of credit there. Talk to your banker, get a good relationship with your banker. Have that person in your office more than once a year. Have that person in your office or go to their office. And make sure you set up a plan for disaster. To not have a plan for a disaster is a disaster. Trust me, that in itself is a disaster because it'll bite you harder than what needs to be. And so I would leave those as some really kind of, I would say, high level things that you should consider.
Very much identify with that. Being prepared and having reserves. I mean, there's a reason my company is called Disaster Avoidance Experts. You want to manage risks, you want to address those things, and you want to have a good plan. Well, thank you very much, Chet. Really appreciate it. And everyone, make sure to subscribe to the show, listen to it, and share it with your friends. All right.
Thank you.
Till next time. and the wisest and most profitable decisions to you in the meantime, my friends.